From the Carl Chevrolet Studios in West Des Moines, welcome to Iowa Live. I am Lou, and time to visit with our friend Dr. Josiah Fitzsimmons from Vero Neuropathy, as it is time to visit not only with Dr. J, but also Amy Hines from a Hines 7 Pet Rescue and Transport, and a special friend that Dr. J is going to help get adopted here today.
That's right. It's Oero. We got to get him a home.
Oero. So we'll learn all about Oero in just a little bit. But Dr. J, let's talk about neuropathy and talk about what people really need to know about neuropathy. Like so many other illnesses and conditions that people are going through, your lifestyle really does affect what happens when it comes to neuropathy.
Absolutely. That's why I talk to a lot of people about the reason they're in the condition that they have is because they've made a lot of, wrong choices on a daily basis over a long period of time. And so if you really want to reverse the conditions that you have, you need to start making the right choices, consistently for a period of time. And peripheral neuropathy is exactly the same case. A lot of people, that just haven't had great diets, lifestyles, whether you have different exposure, different toxins, medications, drugs, or different things that they've been exposed to throughout their whole life. Bad products, can really lead up to that breakdown, inflammation in their body, breakdown of the nerve, and then the peripheral neuropathy symptoms.
Right. Now, you said the inflammation in the body, the breakdown of the nerves, are those hand in hand? Those go, one leads to the other?
Absolutely. So typically what's going on is people have inflammation throughout their bodies. Easy way I explain is, I try and give you a phone call, and if there's static on the line, you have no idea what I'm saying, even if I say all the right words. Same thing with their body. If you have inflammation in your body, then your body's not going to be able to communicate properly, and it's not going to be able to heal the way it's designed to.
All right. Now, when it comes to, it sounds like eating poorly is a big factor in all this. Does taking supplements, does that help at all?
That's a great question. The way I recommend supplements is they should be an add-on to what you're already trying to do. You should be really eating most of your diet, very healthy diet with, good fat, healthy fats, good lean meats, good vegetables, drinking lots of water, getting exercise. Those are really the basic foundations that people already know. Most people just don't do it.
Yeah.
And then if you do have deficiencies, in different specific nutrients or micronutrients, that's where supplements, can really play a big part in getting you over the edge.
So you're saying eating the vegetables and the whole grains and the fish and things like that, that's important, but having the supplements as an added boost, that really can help.
Absolutely, but for most people with neuropathy, it's been happening and occurring over a long period of time. It's a progressive degenerative condition, just doesn't rise up overnight. It takes lots and lots of years for peripheral neuropathy to develop. And so if we really want to attack it, and get results at a fast pace, we really need to change lifestyle. We need to, add in new supplements. We need to add in equipment. Our whole entire protocol is really a peripheral neuropathy, treatment plan, to really start reversing those symptoms, getting them their life back at a much faster pace.
Now, in order to stay healthy, I know exercise is always recommended, but if you have peripheral neuropathy, you're probably not going to want to exercise. How do you address that?
That's a great point. And so that's where my master's in nutrition actually comes into play, because about 80% of weight loss is eating properly foods. You can exercise for a long period of time, but it might only take you 2 or 3 minutes to consume the amount of calories that you burned in an entire hour of exercise. So it's really, really important to focus on your diet first and foremost. Then as you start to get some of that mobility, balance, feeling back, some weight loss that start to occur, then you can really start to get more into exercise. But first and foremost, really need to start with the diet.
What can you do for somebody? What are some of the treatments that you offer?
Great question. So we do have, like I said, a 4-part treatment protocol. So the first piece of the treatment protocol is actually a piece of equipment that actually helps regenerate the arteries. And then the other part is restore that coating around your nerves. At the same time, with the supplements, we're actually helping decrease the inflammation, improve the blood flow, and allow their body to heal from the inside the way it's designed to.
Yeah, we have some video here showing you some of the treatments that you use. We do have some people that are getting treated, and this is right in the comfort of your own office here, and you're putting on a device here. What will this do?
Yeah, so this is actually a low-level light therapy device that actually helps regenerate the arteries, helps you help recreate that coating around your nerves, so that you can actually get permanent correction and restoration, of those nerves working properly, rather than just masking the symptoms like a lot of the medications do, like we've been talking about. Our entire goal is to actually recreate that coating so you can get long-term correction.
All right, so this right now you have a special we want to talk about too. If you want to get treated, what can we do with the special?
Yeah, biggest thing is really diagnosing the condition in the first place. If you've gone to, maybe primary care physician, they probably poked you, with a sharp stick on the bottom of your feet or in your hands, asked if you could feel it or not feel it. Typically they only do 1 type of test. We're actually going to do 8 different unique types of tests in our office to diagnose exactly, where the neuropathy is, what's what's going on, and then come up with a personalized treatment protocol.
All right. Now, that's important to take advantage of that 335-VERO. That is the number to get a hold of them. And Amy Hines has Oero here. If you are living without pain, you can play with your pet more like Oreo, Dr. J. Amy, tell us about Oero.
Well, you can, instead of eating Oreos, you could just adopt one, and that would be a good start, right?
That's great.
Get your exercise. Now, where can we find Oreo at?
Oreo is at a Heinz 57 Pet Rescue and Transport, and you can just go to heinz57.com to find his information and apply to adopt him.
And do we know how old Oreo is?
He's about 5 years old.
Oh, that's not that old.
No, and he loves everybody. He gets along with all people, kids, other dogs, cats. He loves everybody.
There you go. So we need to find Oreo a home, a Heinz 57 Pet Rescue and Transport, a heinz57.com will get you to the best place, correct?
Correct.
That's awesome. Amy, thank you so much. Thank you, Oreo, for coming in. Dr. J, again, take advantage of the $49 special right now, 335-VERO. That's 8376. Thanks for coming in, buddy.
Absolutely. Thank you for having me.
All right, we'll be right back. This is Iowa Live.